Hi, Dr. Tillman. This is Evelyn. I'm Ivan Emoto's nurse. Ivan Emoto is a 67-year-old male. He has allergies to penicillin, midazolam, and cephalosporins. He was admitted to the hospital with a diagnosis of CHF exacerbation. He does have a past medical history of chronic heart failure for the last 7 years and does have hypertension as well. He did state that he has not been taking his medications and he ran out of some of his medications. His sole provider is his wife, and they are having some issues adjusting to both of their care. Vital signs were pulse 107. It was irregular rate and rhythm. Blood pressure was 159/107, and his breathing was shallow and labored, and O2 is 87. He was short of breath. I did teach the patient to use incentive spirometer, and he did report a productive cough, about 15 mLs of white sputum, and it was a thinner secretion. He did have crackles bilaterally, and he has not voided in 10 hours, so I went ahead and catheterized him according to your order. He did have some results come back. His chest x-ray showed his heart was enlarged and infiltrates were noted. EKG, he was tachycardic. It was a 12 lead. Hemoglobin was low. Hematocrit, white blood cell, BUN was a 6. White blood cell was 11.9. And glucose was 118, and that could just be the beta blocker he's on. He did have a medication list that was provided by his pharmacy. He's on metoprolol, 100 milligrams at the hospital. He's on Lipressor, 50 milligrams twice a day. Patient is on digoxin and did not have any digoxin levels drawn, so I would recommend we go ahead and draw some labs. If no change in edema, I would recommend that we increase that Lasix dosage to 40 milligrams.
Okay, so go ahead and draw the digoxin labs, and if there's no change in the edema, give the Lasix 40 milligrams IV BID.
Okay, so just to double check, let me repeat that back to you. I'm going to go ahead and increase that dosage to 40 milligrams BID if the edema doesn't subside or it doesn't lessen. And then I'm also going to draw the digoxin levels, correct?
That is correct.
Okay, thank you so much, Dr. Tillman.
Thank you.
Bye.